The House Health meeting to order. I think we have a full house, and the Sergeant at Arms can let some more in as they can. Good to see you, Representative Gillespie. How's your wife doing? Good?
She's doing well. I'll make sure to let her know you asked.
I appreciate that. We'd like to welcome our Sergeant at Arms and thank them, Terry McGraw, Nina Lage, Teresa Ferguson, and Todd Johnson. I thought Mr. Johnson was a senator, but I guess he's making more money as a sergeant at arms.
I thought the Senate made a lot of money.
Well, you have to talk to them to know the truth. I'd like to welcome our pages, Richard Anthony. Welcome, sir. Representative Escobar, Savannah Gazda. I might have got that wrong. I apologize. Isha Yaha. Was I close? Well, thank you. Samuel Johnson, I can get that one. And Emea Pierce. I saw your father in a meeting. He told me to make sure you were behaving up here. We have a lot of bills today. We hope to get through them. We're going to limit the debate to one question till we see where we are. At this time, we'll start with House Bill 906. Representative Bell, I believe you're going to speak, and you have some assistance.
Thank you, Representative Potts. It's always enjoyable to be here at Health, especially when you're chairing. And Representative Potts, we have an amendment to send forward. I believe Representative Campbell is going to send forth that amendment.
Representative Campbell, you're recognized.
Thank you, Mr. Chair. This is just a technical amendment to delete Section 2 of House Bill 906. Thank you.
I assume the bill sponsor is agreeable to
It's a great amendment, sir. So we ask for support.
All in favor of the amendment? Aye. Aye. Any opposed? Thank you, Representative Bell. You're recognized.
Thank you. And members, this is a simple but very important bill that will positively affect many here in our state. Reagan's Law is a bipartisan effort to improve care and support for amputees here in North Carolina. It's named in honor of someone I deeply admire and care for, Reagan Perry, the daughter of my friend, former Senator Jim Perry. And Mr. Chairman, if it's in order, I'd like for the committee to hear directly from them because no one can explain this bill better than Reagan herself.
Ms. Perry, you're recognized for a brief comment. Thank you for coming.
Thank you, Mr. Chairman and members of the committee. My name's Reagan Perry, and I've been an amputee for almost a year and a half now. My experience is the reason that this bill is named Reagan Law, but it is by no means only about me. Less than 2% of the national population are amputees, so the issues we face are not well known. And as of right now in North Carolina, insurance companies are only required to provide one prosthetic to amputees that is good for walking and walking only. They deem anything else not medically necessary. How I like to explain it is if you tore your ACL, insurance would provide coverage for that technically elective surgery and provide coverage for all the physical therapy, braces, anything else you need to get back to the standard of life that you had before. But for amputees, if you lose your leg, insurance only requires coverage to get you back to walking. So walking is, all they provide coverage for. Reagan's Law would change that and require insurance companies to provide coverage for sports-specific prosthetics that otherwise are about $50,000 out of pocket, so really out of reach for the average family. I'm sure many of you here are fortunate to have played sports or have children or grandchildren that do so. You know those positive life lessons that come from this, the community and support that come from being able to play sports. And you know that being active is good for both your mental and physical health. Movement is medicine in its most basic form. So I'm here today to ask you to support Reagan's Law so that a small and often silent community in our state can have access to sports, movement, and the community that comes with both. Thank you.
Thank you, Ms. Reagan, very much for being here today and sharing your experience. You have any further comments, Representative Bell?
Chairman Potts, I could not explain this bill better myself, and Reagan speaks for not just herself, but many here in North Carolina, that this denial of coverage is preventing them from running and living a healthy and active life, and I ask for your support.
All right,
One point.
Representative Lamb.
I just want to make a point. I've had a number of conversations with the prosthetic device makers, and it's been a number of years since those individuals have received any type of rate increase. So they're struggling, and I think we need to take that into account, as well as making this more available for those who need the care. But I think at some point we have to do something to those who make these devices as well. Hadn't related to this bill, just a comment.
Thank you. Any further comments before I entertain a motion? Representative Cunningham, do you have a motion? You look like you did. I just want to check. Yeah, Representative Reader, you're recognized.
Yeah, I recommend that we adopt as amended, rolled into new PCS, and the next stop would be rules, calendar operations of the House.
Unfavorable to the original PCS, I assume.
Yes.
Or,
There was an amendment.
okay.
They need to vote.
It's rolled into a new PCS. Motion favorable for report on House Bill 906 as amended, unfavorable to the original bill rolled into a new PCS with deferral of the insurance. Is that your motion?
That is exactly what I was thinking.
Thank you. All in favor of the motion, aye.
Aye.
Any opposed? Thank you, Representative Bell.
Thank you, Mr. Chairman, members of the committee.
Perry, for being here. This time we'll look at House Bill 746, Representative Carson Smith. One of my favorite sheriffs, particularly when you're not in office.
You're my favorite chair when I'm before this committee or any other committee. Thank you, Mr.
Thank
Chair.
you. You're recognized.
Thank you, members. When working on this bill, it was really one thing that we wanted to accomplish. It is to restore the limited immunity that RNs have when following the orders of a physician. I'm probably going to read a little more than I usually like to kind of talk to y'all. I'm going to read a little more because I'm not a lawyer. I want to be sure I get all the key information to y'all, and we'll see what we can do. The opinion Byrd versus Marion General Hospital became case law in 1932, and it lasted almost 90 years. The court ruled that a nurse had no personal liability for following the doctor's order unless, and I quote, such order was so obviously negligent as to lead any reasonable person to anticipate substantial injury. That case law was overturned in 2022 after about 90 years of being case law in the state. In 2022, Connett versus Charlotte Mecklenburg Hospital Authority, and they opined, and I quote, even in circumstances where a registered nurse is discharging duties and responsibilities under the supervision of a physician, a nurse may be held liable for negligence and for medical malpractice in the event that the registered nurse is found to have breached the applicable professional standard of care. Now in Connett, both the majority opinion and in the dissent basically indicated that protection from this liability should be a function of the legislature. They kind of said, you know, if the legislature wants to do this, they need to do it. It kind of got my attention when I was reading it. What both cases involved a registered nurse. In Connett, the most recent decision, the nurse was an advanced practice registered nurse, an APR, and it was a nurse anesthetist, something that was not around when Byrd was decided and became case law. That's kind of what makes this bill not so simple, the discussion around it not so simple. The Connett ruling was in the case with the APRN, but it will expose all nurses to malpractice liability for carrying out a physician's order. I think this bill is needed. I realize it needs some work. Some of the language in it needs to be cleaned up. We need to be sure that it does what we intend it to do. Unfortunately, as everybody in this room knows, we kind of run out of time. So, and we got crossover coming up next week. I'm very interested on the debate from this committee on this bill. I would ask when we're done that we can get it past this committee, continue to work on it. It does have one more stop, maybe do some wordsmithing on the way and get it past crossover. And once we do that and get it in the Senate, I think we can really take some time and get this written the way we intended it originally, to just do that one thing to provide that limited liability to the nurses that they have basically lost in the Connett decision. And Mr. Chair?
Thank you. I believe we're going to start part of the cleanup process today. There's an amendment from Representative Lambert.
Yeah, this is part of the cleanup. It's purely technical. Staff recommended it. If there's any questions, we can answer those. But it's, again, just a cleanup of some of the language in here related to one of the general statutes.
I assume the bill sponsor is agreeable to that.
Yeah, absolutely, thank you.
Okay, all in favor of the amendment? Aye.
Aye.
Any opposed? Any questions from the committee before we entertain a motion? Representative Reader.
Sorry for maybe one or two, if allowed. Question.
Make it a Blackwell long one and we'll be fine.
It's a 5-part question with 3 subsections. No, I appreciate you bringing this bill. I work with a lot of nurses, and one of the things in here, it says that the primary duty of a nurse is to diligently execute the orders of a physician. And nurses are a profession. They have independent thought, actions, and nurses have saved my bacon more than once when I've done something that wasn't as grossly negligent, but sometimes you overlook. And so I'd be interested to hear what you think the responsibility for professional opinion, thought is related to the profession.
Representative Smith.
What? Ask that last part again, Doc. I'm sorry.
Yeah. So in this, the way I read this, it seems to take away all the professional judgment responsibility away from nursing, and I'm just trying to understand how we maintain that with this bill.
I think that's part of, there is some wordsmithing that needs to happen to this bill. That was not the intent. That is one of the parts that I do think needs changing. And again, the issue is we're running up on this hard deadline, but I completely agree with you, and that is one thing that we're looking at, trying to clean that up.
Representative Campbell, you're recognized.
Just a clarifying question. Under Section 1, is it the intent of this bill that APRNs are going to be included in this language as well?
You know,
You're recognized.
one of the things that I think is up for discussion is, should this include all RNs or should APRNs be carved out? Again, under Connet, APRNs were here. Under Byrd, they were not here. APRNs, I would think, and again, I'm not a doctor, I'm not a nurse, and I'm not a lawyer, but I would think APRN as a provider probably is more covered on the liability side. If something were to happen and they were sued, where a registered nurse probably doesn't have the same coverage because they're not a provider. They're a medical health care provider, but not, I guess, that what doctors and APRNs are called providers. And again, I'm kind of over my head. That is one of the things I think that is up. If we can keep this going, will APRNs be included or will they be carved out? And there's a lot of difference. There's a lot of debate on that too.
Representative Cervania.
May I ask the bill sponsor a
Yes,
question?
ma'am.
Dr. Reader's question actually brings up an important point that I'm very concerned about. There's not a change in text about this first. So we'll walk this together, hopefully, and then I can ask my question. The question is, nursing is a field and a separate profession. Many nurses, be it if they're beginning stages or an advanced practice nurse, have a lot of latitude in many healthcare spaces. This bill almost says that registered nurses maybe should be only under the direction of supervised healthcare provider, which there's a lot of movement in our APRNs to be seen as wholesale healthcare providers. So I ask of you to reinforce the question. I'm going to ask it again. That is the intent of this section also to maybe not recognize that a registered nurse. Okay, go ahead. Thank you.
Representative Smith, would you like to comment?
Thank you. And again, and it's the intent of this section, the intent of this bill is to do one thing. to reestablish the limited liability protection that nurses had for 90 years. This section needs to be reworded. I completely agree. And the issue that you brought up and Representative Reed brought up, I completely agree with that and needs to be worked on. Again, I hate the way it's run. It's been so late. I would have loved to have this out and vetted a little bit before now. So we are running up against crossover. But I completely agree with both of what y'all said. It will be rewritten if we can keep it going. I think the question is, does the committee want to reestablish some type of liability that nurses used to have?
Thank you, Representative Cunningham.
Thank you, Mr. Chair. Let me just go a little bit. The bachelor science degree nurse is a critical thinker and does judgment calls. She remains under the supervision of the physician or whoever the attending physician or authorized medical provider is. If we're looking at putting back in place that governance, that's good. But if we're looking at all registered nurses, even the advanced practice nurses, that's a second thought. Because if we're going to have them to function under the physician as supervised, then that physician or whoever that health provider is must provide that supervision. And I'm not talking about online. I'm talking about in person. So if we're going to do it, I agree with you that we need to do some additional work in that space, because independent practicing nurses, even though it says supervision, they're really independently practicing and providing some of the best quality care that we can get. So Representative Carson Smith, I agree, let's do a little bit more. Thank you.
Thank you. Is there a motion? Representative Loftus. I'm out. We have an injured player on the 20-yard line. Is there a nurse in here that we can provide? We may need the player's back in the game now. No, he's not. They're helping him off the field. Representative Loftus, hang on to that motion. We're going to get you. I already called for the question. Motion. Representative Loftus, you're recognized.
Mr. Chair, I'd like to make a motion for a favorable report as amended, unfavorable to the original, with on to Judiciary 2, I believe.
Rolled into a new PC.
Rolled into a new PCS.
You've heard the motion before us by Representative Loftus. All in favor, aye. Aye. Any opposed? Ayes have it. The bill passes. Thank you, Representative Smith.
Thank you, Mr. Chair. Thank you, members.
We'll move down to House Bill 727. Representative Reader. You're on 727. Oh, Representative Blackwell. Well, it's certainly a pleasure to see you running a bill today. This is the highlight of my morning, other than my honey bun that I had for breakfast.
Well, I'm going to see if I can sweeten your day further.
Well, that'll be unlikely, but you can certainly try.
Well, if I fail, if you could just sweeten mine by getting a unanimous favorable report, that would be appreciated.
Thank you.
I don't think that anybody fails to understand the shortage of various workforce types that we have in the state, and that certainly includes a shortage of mental health workers. Currently, under the state law, we have a 5-year requirement that someone who has practiced in another state and has passed the national test for a marriage and family therapist can come to North Carolina and practice. Because of our shortage and with the emerging workforce problems we have, licensure portability or interstate compacts is essential if we're going to attract students into the profession, as well as, with North Carolina's growing population, attract the therapists that we need. The North Carolina Association of Marriage and Family Therapists has been working with the American Association in other states to reduce those requirements, which in North Carolina currently is 5 years for practice in other states. In 2024, Virginia, Maryland, Tennessee, Georgia, Arizona, Illinois, and Iowa enacted laws to reduce the years of experience for reciprocal MFT, that's marriage and family therapists, practice to either 0 or 1 year. In 2025, similar legislation has been introduced in Kentucky, Alaska, Nebraska, Texas, and is expected in 5 other states. We have graduate programs at Appalachian State and East Carolina, and what we would like to do is recognize that these folks are eligible to bill Medicaid and Medicare, and they're recognized by the federal government as one of 5 core mental health disciplines. They're licensed in all 50 states. What we would like to do to expand the mobility is in North Carolina to reduce that requirement from 5 years to 2 years. They would still have to pass the same test that everybody else in the nation has to pass, although California has a unique test that is also acceptable. And so what we would like to do is pass this legislation, but I would also have an amendment that I would like to offer at this point, if I may, Mr. Chairman.
You're recognized for an amendment that I didn't get earlier. Yes, sir.
Well, I don't know why the staff falls down on this sort of thing occasionally.
Well, there you go. You'll probably.
But I'm not calling any names.
You'll probably fall down the steps on the way out of here.
I think you're going to have to go to a sensitivity training class.
I think
it's an anti-ageism remark.
I'm signed up for one in 1994.
Yeah.
2094. Okay, we have a motion.
Yes, sir. The amendment simply would strike a portion of the bill that's before the committee to essentially change 5 years to 2 years, and otherwise leave the testing requirement as the national test that is in place, as I understand it, in all other states in the nation. We still will have a longer period than a number of states who've gone to the 0 and 1. So if there are questions, I'm glad to try to respond.
We have the amendment before us. All in favor of the amendment, aye. Any opposed likewise? The ayes have it. Representative Cunningham, you're recognized for a motion.
Thank you, Mr. Chair. I make a favorable report as amended, rolled into a new PCS, favorable to regulatory reform, and then on to rules and calendar operation of the House.
Thank you. You've heard the motion. All in favor, aye.
Aye.
Opposed likewise. The motion passes. The bill is carried. It's House 727. Thank you, Representative Blackwell.
Thank you, Mr. Chairman, for your sweet treatment.
House Bill 602, Coach Safety Act, Representative Reeder. I believe you have an amendment on that.
Yes, Mr. Chair, thank you very much. I would offer the amendment up. This is really just a little bit of grammatical change to the bill. It doesn't change it fundamentally, and I'd ask your support on the amendment, and then I can speak to the bill.
You have the amendment before you. Any questions? If not, all in favor, aye. Opposed likewise. Motion passes. The amendment passes. You're recognized.
Thank you very much, members of the committee and Mr. Chairman. House Bill 602, the Coach Safely Act. First want to thank Representative Willis, who's been working with me on this. We know that youth sports are an important part of growth and development for personal identity. Many children participate in them. And I think that for many of us, things that we learned in youth sports help guide and change us for our lives. There are about 35 million children annually in the country playing youth sports, and many kids play more than one. And I think some of the members of the committee think that their primary role is to be the transportation coordinator for their children to sports activities. Unfortunately, with these activities, there is significant risk for injury. It's estimated there's about 8 million medical visits and about 10,000 hospitalizations from sports-related youth injuries. Many of these injuries can be prevented if the coaches were informed and implemented some prevention strategies. While there are some requirements for high school coaches, in younger ages, there's really no requirements out there right now. I know that many teams struggle sometimes to find volunteer coaches, and I don't want to place an undue burden on them with this bill. But what this bill does is require some annual training for coaches that might not be associated with a school. It might be an association, a team sport, or something else. Annually to do this training and keep it documented. In the bill, there's a couple programs that are named that offer some of this. I'm not advocating any particular organization or agency or group that's out there. But those organizations, most of this training can be done within a couple hours per coach and at minimal cost. This bill came to me. Alabama and Arkansas have passed a similar requirement. Georgia and Tennessee have recommended this training but not be required. I hope that you will help support this bill to protect our children who are active, that should be in sports, but just to make sure that they're safe. And I'm happy to stand for any questions.
Thank you. You've heard the presentation. Are there any questions? Yes, ma'am. You're right.
Thank you. Just a brief question to the bill sponsor, please. Thank you. Yeah. So I appreciate the bill. I was a parent coach for YMCA, so I'm just curious for like a youth sports league for my daughters. So I understand as a volunteer, I'm fine to do the training, but like monetary, how are we financially supporting like the YMCA and other organizations to implement this training?
So most the programs that are out there are minimal training. The organization that came to me, they have an online module that can be as little as $20 for areas that are more socioeconomically challenged. They can actually waive some of the fees for that. So I think for that organization, if you're coaching a team, that minimal fund fee should be able to be accommodated in that. It's really not the intention to make it expensive or to profit any company that's out there. There's a lot of different places you can get it. Depending how much money and where you want to go, you can do something really fancy and really expensive, or you can do it online for minimal cost.
Thank you. Thank you, Representative Clark. Chairman White.
Representative Reeder, I know in a lot of the communities across North Carolina, there's clubs like the Civitan Club, and they've had very successful programs for a lot of different sports. And they usually do have like an overseer, you know, that maybe not just a parent, but someone who's actually played the sport professionally or played in the community for a long time and has got a good record. And they do have programs for indigent children in their cheerleading programs and their Pee Wee and Mighty Mite football teams and so forth. So are we actually saying that these clubs that are usually functioning on a small budget anyway, that they have barbecues and earn the money that they have their clubs with, are we saying that they would be responsible by law to have each volunteer that trains or coaches to pay a certain amount of money to have this professional training? Is that what we're saying?
Representative Reeder.
The bill would require training. As I said, most of the training, and we outline a number of minimal standards for that training. These can be obtained either free or really at a nominal fee for that. Ideally, there are injury-specific trainings for sports. So if you are if you're a youth female who plays soccer, your injury is going to be an ACL tear. That's what's going to happen to you. If you're in different sports, there should be more specific training by sport. That would be the ideal. This just sets out a minimum standard for safety.
Follow-up question. So when we're talking about children that range from usually 5 to 13, and they are really just kind of learning the sport. I mean, they're not really competing at a high level of intensity, but it's more of it's an enjoyable opportunity, and it's a social opportunity as well. So, but I'm just trying to understand, are we going to be saying that Civitan clubs across North Carolina are now going to have it basically trained person who can attend to. Now they always have an EMS present when they have their their games and stuff, just because it's a courtesy of the community. But I'm just really concerned about what it's going to do to these programs that do address a lot of indigent children. Are they going to be able to maintain this level of scrutiny?
Representative Reader.
If they use, this is in the definition, if they're using public property that's leased, maintained by the government agencies, they would have to participate, they would have to do this. And I would say 5-year-old probably a little different than a 13-year-old, because I'm sure there's parents of 13-year-olds who are competing on international places right now. So this really sets a minimum. If you're going to be coaching, to spend an hour or two making sure that the children who are entrusted to you are safe, I think is not a high bar to meet.
And just one more follow-up. That's my last one. Okay. So I think I overlooked what you just said when I was looking at the bill. So you're saying that if they're using public property, that this would be enforced, but if they own their own property, like the Civic and clubs usually do, they would not. This would not apply to them. That's
true.
Okay, thank you.
Representative Cunningham.
Thank you, Mr. Chair. I want to go back a little bit, because having everyone trained, even if it is not public, if it's public property and not private property, can be an issue. One of the things that I know for the suicide is you train the lead LEA, and you train them, and then they train the other people, so that everybody doesn't have to go to the modular and it doesn't cost an additional expense, instead of training each individual that's coaching. Can we look at that, Representative Reader, because it is going to cost something, whether it's $20, no matter what it is. You got thousands of people that would have to do that training. And if you train one person at that whole institution, they're responsible for training the other persons that would engage in coaching and athletics.
Thank you. Representative Shepherd.
Thank you, Mr. Chair. This is a question. I guess this applies to Parks and Recreations, because that's a government activity. I think in concept it sounds like a great idea, but when I coached, and I've been president of the league and been on Parks and Recreation Advisory Board, today you have a hard time getting volunteers as it is, and I think this would really harm people being volunteers if they were told they had to do this. It was a requirement if they had to receive this training and had to pay for that training. And that's my only concern, is that it sounds good, but I think in the long run it would not be beneficial. I appreciate it.
You're recognized, ma'am.
Thank you, Mr. Chair. Just a question of the bill sponsor. I've read through the bill a couple of times, and I can't find anywhere in here that there is any reporting. We pass bills up here directing people to do all this training, and we never know if they actually follow through on that. So what is your recommendation for reporting back to the legislature?
Representative Reader.
So there is not a recording requirement. I'm not sure that the state wants to keep track of the thousands of coaches that do this across the state. If I may respond back to Representative Shepherd, the coaches spend time learning about how to play or teach that sport. I think that incumbent upon a coach, if you're going to be entrusted with a child under your care, that you have some minimal education training on how to keep that child safe from injury. I don't think that that's too much to ask. So I recognize and don't want to put an undue burden on the coaches, but when you have the responsibility for a child, I think that responsibility goes with.
Thank you. You've heard the bill presentation and the amendment. Is there a motion?
I got a quick question.
Representative Lambert.
I just have a quick question. I have same concerns has been expressed. Representative Shepherd stated what I was going to comment on, but one other thought of this is it's a big deal to me to go statewide. I would have voted for it had it been a pilot in an area, but I have concerns enough that I'm not sure I can vote for this bill as it is. I have participated over the years in so many Little League coaching events, and I do think it's a good concept, support all that, but I think it's in, the unintended consequences of this we don't necessarily know, and that's why I would have preferred to be a pilot program.
Representative Purtle, you want to comment before a motion?
Just a brief comment. I wonder if the bill sponsor might be open to pushing back the compliance date to give some of the communities time to get this information out to the volunteers and the coaches in order to so they're not held to October's right around the corner, and I know that it will be quite an effort to try to get this done. Thank you, Mr. Chair.
Representative Reader.
So like many of the other bills, there's another stop in state and local government, and happy to look at the pilot, look at any other language that we can do. Ask the committee to support this. We will continue to work on this and in the next week and a half until crossover. So ask for your support and commit to continue to work on it.
Okay. Chair, entertain a motion. Don't everybody speak at once, but if you want to be recognized. Representative Campbell.
Mr. Chairman, I'll make a motion for a favorable vote on this bill with referral to insurance, is that, or state and local?
State and local government.
State and local government. Thank you.
And that was unfavorable to the original as amended, rolled into a new PCS.
That's exactly what I was thinking, Mr.
Thank you. All in favor, aye? Aye. And opposed likewise?
No.
Ayes have it. The bill's passed. Thank you, Dr. Reader. This time we're going to, since it's about lunchtime, we're going to hear about some great lunch meat from Representative McNeely.
Thank you, Chairman Potts.
I believe we have an amendment that Representative Humphrey is going to send forth.
Thank you, Mr. Chairman. I move that we amend the bill.
Okay, the amendment is on the dashboard. I have a motion to approve. All in favor, aye. Any opposed likewise. Representative McNeely, you're recognized. Welcome to House Help.
Thank you, Mr. Chairman. Our mutual friend, the Easter Bunny, told me to tell you bok bok. Just let you know that.
Well, Wayne Newton called and said he wants his coat back.
All right. The amendment that here, actually, this was supposed to be a PCS, and I guess last week I took off and went back to work and tried to make some money and didn't pay attention that the PCS did not get moved forward, the original bill. So what you have before you now in the amendment is a PCS that come out of finance. And this bill is very similar. Actually, it's pretty much identical because I wrote it, the bill that Representative Dixon brought to you probably a couple weeks ago. The only difference in mine is the middle section has what I would call sort of a GoFundMe with the ability for retailers to do a roundup to help with soil and water foundation so we can try to repair and replace what's tore up in Western North Carolina. Also, the very end of it, we're going to do an audit with this bill to let us know the before and after of the damage in Western North Carolina. The department and NC State both have kind of asked for this, and this is good because this will help us understand how our money is being utilized in Western North Carolina and also the magnitude of the job that we have to do before us. So first part of the bill, like I said, I think you've heard that from Representative Dixon, but I stand for any questions, Mr. Chairman.
Okay, thank you, Representative McNeely. Representative Cervania, you're recognized for a question.
Thank you, Chair. I'd like to ask the bill sponsor a question.
You're recognized, and you're recognized to answer.
Thanks, sir. Yes, ma'am.
Thank you, Representative McNeely. Actually, when I read all the bills, it sounds like your bill actually brings back in plant-based sources and insect-based sources. Am I incorrect?
It shouldn't on the amendment. It was in the original, but should not be in the amendment. So the plant-based and also I think the insect-based should be out of it. If I'm not mistaken. I think I'm right. Okay. I'm about positive in the PCS or the amended. Let's put it that way.
Yeah, the amendment went by so quickly, but in just quick read, it does just more specify cell-based. So if you're clear on that, then I'm.
Yeah, I'm about positive that that's been plant-based and insect-based has been taken out.
Yes,
perfect.
Staff,
Thank you.
Correct. Representative Shepherd.
Motion at the appropriate time.
Thank you. Any further questions? not, it's appropriate time, Representative Shepherd.
Thank you, Mr. Chair. I make a motion to approve House Bill 135 as amended and refer to Commerce and Economic Development.
Thank you. All in favor of the motion, aye. Any opposed? Motion passes. Next, Representative Crawford, one of my favorite people from across the aisle.
Thank you, Mr. Chairman. Thank you, committee.
What number is this?
681. Without objection to PCS, I believe was sent out in this before, so you're recognized, Representative Crawford.
Excellent. Thank you, Mr. Chair. And I appreciate being one of your favorite people from across the aisle. Thank you for that recognition.
That's a high honor.
I know it is. Members, thank you so much. I'm going to do quickly explain the bill and then explain what the PCS changes. So what this bill does is it brings North Carolina's opioid abatement treatment centers or treatment programs, OTPs for short, up to the federal guidelines. So the federal regulations were updated in 2023, which was surprisingly the first major time that those have been renovated since 2001. So we are at a time where North Carolina still sees that it has some of the strictest OTP rules in the country and have not been updated with the latest research and information against these federal guidelines. So just a few things that this bill does. It removes outdated barriers that tie take-home medication privileges to a patient's home life, stops discharging patients just because they miss dosages or struggle, which is important because we know that individuals in recovery are going to have struggles. So what the PCS does is that it removes the original Part 5 of Section 1, which was a change made in agreement with the other bill sponsors, Representative Reeder and Representative Chesser. Thank you very much. And it also amends the final section of 1A that was originally 6, now it's number 5, to read that patients who are not enrolled with a specific OTP are now eligible for the administration of methadone if they can be verified as a patient at another OTP through some mechanisms, either by contacting that patient's home OTP or checking the central registry or other means established by the commission to verify that. And then lastly, DHHS asks that the publication of these new amended rules be January 1st, 2026, just to give them time to work on those rules. And I will stand for any questions. And I'd like to remind the committee that I was very quiet today and I didn't ask a lot of questions, so.
I noticed that, and you don't know how appreciative the chair is of that. Is there a motion? Representative Ryan?
Thank you, Representative Crawford, for bringing this forward. I did have a question about, and I appreciate the changes that you made to what was number 6 is now number 5, because that was one of my other questions as well. So thank you for that. Number 2, in my profession, as you can imagine, we see a lot of abuse of the medications that are given in some of these treatment programs. And so wondered if you would be open, and number 2, where it says explicitly prohibit administrative discharge from treatment for a certain amount of time there, like maybe for the first 365 days as this moves forward, because at some point I think we do have to, when people are still continuing to use controlled substances and we've worked with them, we have to question what they're doing with the medication that's being given to them.
Thank you, Representative Ryan. I will say that these, all of the updates do fall in line with federal guidelines, but I'm happy to look at that change and see how that might fall in with those federal guidelines to see what we might be able to do there. Thank you for that suggestion.
Thank you. Representative Campbell?
On that same line, thank you, Mr. Chairman. One other potential consideration, if time-based is not, for number 2, would not really help, maybe another consideration would be that after a certain number of documented non-compliance episodes that they would be eligible for discharge. I'm behind this and I understand what it's trying to accomplish, but we also need to have a stop at some point where the providers have to be able to say this is good after bad. Thank you, Mr. Chairman.
Representative Cunningham, you're recognized.
A motion at the appropriate time.
I believe that's this time. Thank you.
Thank you, Mr. Chair. I make a motion for unfavorable to the original version of House Bill 681 with a referral for the PCS, to a favorable referral for the new PCS, and to refer it to regulatory reform.
Thank you. You've heard the motion. All in favor, aye. Any opposed likewise? Thank you, Representative Crawford.
Thank you, committee. Thank you, Mr. Chair.
We have several bills to do, and we're going to be here to 12:30, so we're going to have to move along. Representative Ryan, you're recognized. House Bill 536.
Thank you, Mr. Chairman. This bill comes to us today as a request from the North Carolina Board of Physical Therapy Examiners. It really just makes technical and conforming updates to the Physical Therapy Practice Act that was first passed in 1985. The bill does not expand the scope of practice for physical therapists in any way, but will allow the board more authority to regulate providers and ensure public health and safety. It has the support of the American Physical Therapy Association of North Carolina, and I know of no opposition.
Thank you. Representative Cunningham.
A motion.
Let me see, is there any further discussion? Hearing none, you're recognized, ma'am.
I'd like to make a favorable report for House Bill 536, refer to finance.
Thank you. You've heard the motion. All in favor, aye. Any opposed likewise? Thank you, Representative
Thank you,
Ryan.
Mr. Chairman. Thank you.
Who's this from? We're going to allow Representative Clampett to move on. He's got another commitment, and he's had some difficult days in the past. So, Representative Clampett, you're recognized.
He just wants to leave.
Thank you for coming. Appreciate it. House Bill 489, Representative Loftus, you're recognized for your bill, sir. We have an amendment. Who's going to run the amendment for Representative Loftus? Are you going to run that? Let's do that. You're recognized for your amendment.
Mr. Chairman, the amendment on bill on page 3, line 25, deleting the phrase GS 58-3-190 are repealed, and 2, substituting the phrase subsection of GS 58-3-190 is repealed.
Thank you. Any questions for the bill sponsor on the amendment? If not, all in favor, aye. Any opposed likewise? Hearing none, the amendment passes. You're recognized to discuss the bill, Representative Loftus.
Thank you, Mr. Chairman and committee members. First, I'd like to thank my primary sponsors for their help in getting this bill together. Representative Potts, Representative Honeycutt, and Representative Lambeth. Many of us have heard the horror stories of individuals receiving an unexpected bill, usually 3 to 4 months after being seen for treatment or at a medical center. According to the AAPC, which is the American Academy of Professional Coders, which much of this information came from that I'm sharing today, the No Surprise Act, or NSA, went into effect on January 1st, 2022. It protects people covered under group and individual health plans from receiving surprise medical bills when they receive most emergency services, non-emergency services from out-of-network providers at in-network facilities, and services from out-of-network air ambulance services providers. And in 2 cases, I identified one individual that was air transported was a little baby. They billed the parents for $97,599. In another case where the patient passed away, the estate was billed $82,000 for air transport. It also establishes an independent dispute resolution process for payment disputes between plans and providers, and provides new dispute resolution opportunities for uninsured and self-pay. The reason for surprise ambulance billing in this bill is, unlike a trip to your doctor's office, an ambulance ride cannot be planned ahead of time in case of an emergency. Reasons patient may receive a surprise bill for a ground ambulance include no choice of an ambulance service when dialing 911. In an emergency situation, there's no time to check the ambulance's choices in advance, or there's no opportunity to choose a service if sedated or unconscious. And lastly, there's no choice available at all, only one ambulance contract for the region. In addition, many insurers will not pay for the ambulance call if the patient was treated by an ambulance staff on site and not taken to the hospital. Unfortunately, this can add to a big bill for the patient when operational costs, equipment costs, staffing costs, and payment models are considered. Dr. Karen Cabrilla, a surgical resident at Brigham Women's Hospital in Boston, led a research team in 2020 that found that 79% of all ground ambulance rides could result in an out-of-network bill. Currently, more than half of all ambulance rides include an out-of-network charge. And in fact, 8% of all medical debt in the U.S. is the result of ground ambulances. And so this bill addresses that no surprise billing down the road for a patient who's transported by ambulance.
Thank you, Representative Loftus. For those who may have signed up to speak, I apologize. We have more bills than we do time, so we're not going to have any additional speaker other than the committee. I apologize for that, but as said earlier, we're running up against the deadline. Representative Campbell.
Thank you, Mr. Chairman. Question for the sponsor.
You're recognized. You're recognized to answer, Representative Loftus.
In Section 8H, subsection 1, can you tell us what was the methodology for where you came up with the 400% Medicare rate for that reimbursement?
Thank you for that question. In looking at currently, there are 15 states that provide some level of protection against balanced bills, and those include the following states, such as Indiana used a 400% of Medicare. New York used no Medicare. So there's a varying states between Arkansas, California, Delaware, Indiana, Kansas. There's 15 of them, and it runs from no percent to a high of 400%. And so we felt like the 400% would cover at least a contracted rate for an ambulance provider.
Representative Perret.
Yes, thank you, Mr. Chairman. A comment and a question. I actually was going to ask the same question, Dr. Campbell, about the 400 seems high to me, but I also was curious if you've done analysis on the counties, what counties in the state do not have a predetermined reimbursement rate. It looks like the rate would be 100% of a rate set by an ambulance franchise granted by the county. If that rate does not exist, then the minimum would be 400. Do you know what that would mean for North Carolina?
Representative Loftus.
Thank you, Mr. Chairman. Thank you for the question. The majority of the text from this bill has been provided by North Carolina Office of Emergency Medical Services and their advisory council. I don't know the specifics of that for each county for North Carolina. I don't have that in front of me.
Thank you. Any other questions? Seeing none, is there a motion before the committee? Representative Bigg.
Make a motion for a favorable report to House Bill 489 as amended, unfavorable to the original, rolled into a new PCS with a referral to insurance.
Thank you. That's a great motion. All in favor, aye. Any opposed? Thank you. Representative Perret, you're next.
Thank you, Mr. Chairman. Members, this bill 156, you've probably seen this before. This passed the House last session, near unanimous. It would basically just expand the access for small employers to provide insurance to their employees. This is Part 5 of Article 50 of Chapter 58, would take the number 12 employees, of eligible employees, down to 5. North Carolina is sort of an outlier. There's about 46 states that offer these level funded plans, and only 3 are at an eligible employee threshold of higher than 5. So we're trying to match the other states and our bordering states by going from 12 to 5. I'm happy to answer any questions. Thank you.
Any questions for the bill sponsor? Hearing none, is there a motion? Representative Shepherd, did you make a motion? Representative Humphrey, thank you.
I moved to, let me pull up my notes here, because I moved to House Bill, what number is it? 156 be given a favorable report and be referred to rules.
Thank you, Representative Humphrey. You heard the motion. All in favor, aye. Any opposed? Motion passes. The bill passes. We'll move on.
Thank you.
We have 3 bills left. After we do 567, Representative Wheatley, we're going to divide the time equally among the other 2 and vote on them at the end of the period. Representative Wheatley, you're recognized to present House Bill 567.
Speaker, and I guess I'll hit that button. Bill 567 is a bill on biomarkers. This bill will ensure that North Carolinians can access necessary biomarker testing, reducing the time it takes to receive a diagnosis and enabling access to new disease-modifying treatments and care planning. Current and future biomarker testing aims to benefit patients with cancer, autoimmune diseases, heart disease, Alzheimer's disease, and other neurological conditions, rare diseases, infectious diseases, and respiratory illnesses. Biomarker testing is a crucial step in diagnosing diseases and accessing targeted therapies, which can lead to improved survival rates, a better quality of life for patients, and reduced costs associated with care. Yet these critical tests remain out of reach for many as insurance coverage fails to keep pace with innovations and advancements in treatments. Existing healthcare disparities and challenges to obtaining a diagnosis and receiving treatment may exacerbated if new biomarker testing opportunities cannot be accessed. There are 21 states who've already enacted this legislation. North Carolina can be the next. I believe all of you have received a lot of information on biomarkers in the last couple weeks. I hope you will join me and Representative Penny, Representative Campbell, and Moss in supporting access to biomarker testing to achieve better health outcomes, improve quality of life, and reduce cost for our constituents.
Thank you. I forgot to mention there was a PCS that was sent out as properly before us without objection. The PCS is before us. Representative Cunningham.
A motion.
Okay, thank you. Any comments or questions? If not, your time for your motion, ma'am.
Thank you, Mr. Chair. Favorable to the new PCS 567, unfavorable to the original version, rolled into a new PCS referral to appropriations. Thank you.
You've heard the motion. All in favor, aye. Any objection, aye. Thank you. The motion passed. The bill passes. We have 2 bills. They're going to do 10 minutes each. At the end of the 10 minutes, we're going to vote on the bills. We have to be out of here. We have other committees. So at this time, I'm going to call Representative Loftus to present 560.
Thank you, Mr. Chairman and members of the committee. Today, I'm asking for your support on the Parents Protection Act, House Bill 560.
Excuse me, Representative Loftus, here's an amendment. Are you offering that amendment?
I am.
Okay.
The amendment changes the age grouping from 16 to 15 is the only text change to that.
Okay. Any questions? If not, is there all in favor of the amendment? Aye. Any opposed? Thank you. You're recognized.
Thank you. For centuries, our legal system has recognized that government should not interfere with the decision of parents unless those parents have been proven unfit in the court of law. This isn't just a legal tradition, it's a moral one. We presume that parents love their children, and that just isn't a legal tradition. It's a moral one. We presume that parents love their children more than any bureaucrat or judge ever could. Across the country, the presumption is being stripped away from parents, particularly when it comes to the sensitive issue of gender identity. In Indiana, Mary and Jeremy Cox lost custody of their son simply because they could not in good conscience affirm a gender transition that violated their deeply held Catholic belief. In California, Adam Vina lost custody of his 5-year-old son, was issued a restraining order, and was blocked from accessing his child's medical records, all because he disagreed with his girlfriend over the child's gender. And lastly, in Oregon, Jessica Bates, a mother of 5, was denied the opportunity to adopt because she wouldn't commit to supporting a medical transition for a future foster child. The Parents Protection Act ensures that this does not happen in North Carolina. It makes clear that no parent will be labeled abusive or unfit simply for believing that boys are boys and girls are girls. It protects adoptive parents, biological parents, and foster care providers from having their moral convictions weaponized against them in court. It is important to highlight that this bill does not do. It does not allow a parent to abuse their child and try to defend their abuse by saying they disagree with their child's feelings. It simply ensures that the government cannot redefine child abuse to mean refusing to affirm gender ideology. The bill does not tell any parents what to believe. It simply says that if you hold traditional, historic, and scientific beliefs about gender, the government cannot use that against you to take away your children or deny you the right to care for children or others in need. With that, Mr. Chairman, I will stand for any questions.
Thank you. Questions from the committee? Representative Clark.
Question for the bill sponsor.
You're recognized.
Yes, I have serious concerns about this bill, and I'm particularly concerned about LGBTQ youth when it comes to mental health and suicide. So I would love to hear from you how you believe that this is actually going to reduce the amount of suicide and mental health illnesses by implementing this legislation.
Representative Loftus.
Thank you, Mr. Chairman. That has been, if you look at the evidence from 10 to 12 years ago, this was a European discussion that was led into transition and affirming care. Since that time, suicide has been a part of a lot of things of growing up, but there is no evidence that shows that suicide will be an overwhelming part of this bill. All this bill does is protect the parents, that this can't be used as a weapon for you not to be a foster parent or a parent.
Let's get the questions and see if we have time for a follow-up. Representative Crawford.
Oh, sure. Thanks. I wasn't sure I was going to get next on here. So you mentioned that this bill does not change any of the child abuse laws. And I'm just curious, are there situations where emotional or psychological harm, not just physical harm, could endanger a child's well-being?
You're recognized.
Thank you, Mr. Chairman. I think we have seen since this issue has become highlighted in our country, there is always dangers to different children's of how that's being addressed through their parents, through their foster parents, and through the community. What this bill does is trying to address the opportunity that currently exists in the North Carolina Social Services area, that it uses NCGS 131D-10.1, the Foster Care Children's Bill of Rights, as a legislative authority to issue the guidelines. And what we're saying is we don't want that to be used against parents simply because you don't choose to affirm transitioning or gender care to be used as a basis of removing a child from the home.
I'd like to ask the bill sponsor a question.
You're recognized.
So I've actually worked in my career in this space. I agree in the front end that we can't assume that all parents, be it lawfully, including morally, are doing the best interest for their children. But abuse and neglect include not only physical abuse, but emotional and psychological abuse, as my colleagues have mentioned. Refusing to acknowledge somebody's identity is some of the worst emotional and psychological abuse somebody can receive. Even as a young person going through puberty, even young kids, they already know, and they're trying to express this to their parents that are supposed to be loving and caring for them. We already have protections in our laws to protect children, but to add this added language, why was it necessary? Was it to align with previous laws that we passed in the last session? Or is it really to help protect the psychological and emotional states of our children who are going through this time in their life?
Representative Loftus.
Part of the information I received from DHHS, according to the guidelines, when performing an initial assessment of safety and risk during a CPS assessment, welfare workers should consider whether the parents or caretakers' attitude toward the child's sexual orientation or gender identity are impacting the immediate safety of the youth or putting the youth at risk of emotional or physical harm. Furthermore, in addition to verbal harassment or physical punishment because of the child's actual or perceived sexual orientation, gender identity, or gender expression, the social worker should consider the following, among other things: being required to be straight as a condition for remaining in the home, being forbidden from dressing or grooming consistent with the youth's gender identity, being subjected to psychologically damaging reparative or conversion therapy, designed to change sexual orientation or sexual identity, and lastly, pressure to be more masculine or feminine. So those are the guidelines from within DHHS, North Carolina, and I just want to make sure those guidelines aren't used to take a child away from a parent or a foster parent.
Thank you. Time for debate is up. Representative Biggs, you're recognized.
I'm going to make a motion for a favorable report to House Bill 560 as amended, unfavorable to the original, rolled into a new PCS with a referral to J2. Looks like.
You heard the motion. All in favor, aye? Aye. All opposed? No. In the opinion of the chair, the ayes have it, and the ayes do have it. The bill passes. Thank you.
Mr. Chairman.
House Bill 139, Representative Baucom. Seeing Representative Baucom, knowing she's from the mountains, reminded me of a friend of mine who was a Methodist preacher. And about this time, he went to visit one of his more poor widows. And while he was there, he hadn't had lunch, so he was eating the peanuts till finally he ate them all. And he felt bad about it, so he told the lady, Sister Susan, I apologize for eating all your peanuts. I'll bring more. She said, don't worry, since I lost my teeth, all I've been able to do is suck the chocolate off. Representative Baucom.
Thank you, Mr.
I forgot
Chair.
I forgot you were a preacher representative here. You're recognized.
Thank you, Mr. Chair. Thank you for allowing me to speak on House Bill 139, the Baby Box Newborn Safety Device Bill. This legislation expands on North Carolina's current safe surrender laws by allowing qualified emergency departments, fire stations, and rescue squads to install a newborn safety device, commonly referred to as a baby box. These devices offer a secure, temperature-controlled, alarm-monitored location where a parent can safely and legally surrender an infant anonymously, no questions asked. This is not a replacement of our existing surrender process, but an expansion on it. It's an additional option designed to protect the life of a newborn while offering dignity and privacy to the parent in crisis. No parent should ever feel so desperate that abandoning their baby in an unsafe place feels like their only choice. Something we did mimic in this bill is the current language for safe surrender laws, which I think Representative White, who worked very hard on those laws, so that's why we copied a lot of its language. These boxes are already in use in more than 15 other states with no reported safety failures or any injuries. We are modeling our approach based on best practices to ensure the safety and medical care and eventually placement of the infant handled appropriately, which we're using through the DA's Association, who help write the legal language to match what we already have with safe surrender. I respectfully ask for your support for House Bill 139 and stand for any questions.
Have you cleared this with any other law enforcement, sheriffs or any
Sheriff's
other?
Association. So currently there is 2 boxes. One in Gates County and one in Ashe County, which is at a sheriff's department. So yes, we have.
Chairman White, you're recognized now.
Thank you. I was not going to say anything, but since my name was referenced, I do have to make a clarifying statement. I did speak with, when I found out about this bill last Wednesday or Thursday, I didn't find out about it directly, but I accidentally saw it anyway. But I did talk with Representative Bachman. I appreciate all the work that she's done on this bill. I know that she's worked very hard on it. I did ask her, was she aware of the Child Fatality Task Force that has been working in this state for plus 20 years with some very good outcomes to protect children. And several years ago, we put out a safe surrender bill, actually before I even arrived in the General Assembly. It needed some updating. So, 4 years ago, or 2 years ago, we updated the safe surrender bill, and it has been working very good in North Carolina. It's just a very solid bill. And the thing that we added 2 years ago was and this was supported by the Senate and the House. And what we added is an opportunity for the father of the infant, if he became aware of it when the unmarried couple were, if the father found out, he could claim an ownership of the child. And there were some other things to tighten it up to make it safer. But safe surrender overcame the incidents of mothers taking their babies and putting them beside a trash can or out, and it's very strict in the process. It's open to everybody, and it's very well advertised. And the firemen, the police, the sheriffs, the highway patrol, everybody knows about this. The health departments. So there's multiple places that you can surrender your child. But that is surrendering that child to a human hands. I appreciate the work that Representative Bachman's done on this. I wish that I had known about it sooner. So when I talked with her last week, she was not aware there was a Child Fatality Task Force. She was not aware that there was a safe surrender law already in place.
No, I knew about you're right, I did not know about this child.
I was just clarifying. So I cannot vote for this bill. It's not because Representative Bachman's not done a great job in trying to help. I don't know this company that's produced these boxes, but I guess as a registered nurse, as a mother, I cannot, and knowing how long we've worked on the safe surrender law that is working, all bills that we put out are not going to be perfect anytime. but we have had very, very few issues with this safe surrender bill, a law that's out there. So I can't vote for this because it's just a personal thing for me. I cannot see putting a baby in a box. And you know, bells and whistles don't always work. Computers don't always work. And if something happens to that baby before anyone knows that that baby's in the box, I can't do that. So this is not a vote against Representative Balkin's bill. I just can't vote for it. So thank you. I just wanted to clarify that I'm not endorsing this bill, but I'm not trying to ask you to vote against it either. I'm just saying for my personal self, I cannot do this.
Representative Clark.
Thank you. A comment about the bill, please. I just want to say I am sad that we are debating this type of bill instead of what women and mothers actually need to bring a healthy child into this world and thrive. So on the front end, access to contraception would have been more helpful, and on the back end, allowing longer time off from work, paid leave, access to preschool, et cetera. I'd love to work with you on those actual things that will help women feel more capable and competent to actually bring a child into this world and thrive. So there's other areas we should be focusing on. Thank you.
Thank you. Let's keep our debate on the bill. Representative Crawford.
Thank you, Mr. Chair. So just a question. I have a few concerns, and I do appreciate your work on this bill. And I know you have worked a lot on it. A question on page 2, lines 32 through 35, I think, where it references Division of Social Services. Does this bill is requiring Division of DSS workers to do the inspections of these baby boxes?
You're recognized.
Yes, ma'am. We actually have 15 states that already do this, and out of those states, 4 of them use that service to do that. They also have, so the National Coalition of Safe Surrender and the manufacturer also does that when they install them too. I can explain on the training portion of that. They actually teach every single portion of the people who work in that building, all the training. They have a yearly training, and then any new employee that comes in, they will train. So just so you know that.
I know we don't have time for follow-up, but I'm just make a fast comment. I would love if you would be willing to work on that section of the bill to see if we can get to maybe think about that a little bit differently. I like the liability living with somebody else. I don't think we're going to pay our DSS workers any more money to do this. So if we can, I would love to work with you on that if you're open to it.
I'm open to it. We actually have a companion bill in the Senate, so that works. We can do that.
Thank you, Representative Savania. We're going to limit it to about 30 seconds.
Yes.
We're out of time.
So I'm concerned about the ability for alarms and climate control on those boxes. Like both of you have mentioned that it already exists. Has there been any problems with those two things? Because just putting a baby in the box and that alarm and that climate not being, and if we have a child fatality, that's not going to be a good thing.
Representative Balkin, quick response.
Okay, I'll do my best to do it quick. So the way the alarm works is automatically when you open it, it goes off. The baby hits when she puts the baby down, or father, whichever, it will also send another alarm that also insinuates that the baby has been placed into a weighted. They test these weekly, actually, every week. The average wait time is only 2 minutes for the babies that's been saved. They also actually send 911, so they get both of them. But these buildings have to be staffed 24 hours a day, so there's someone in the building who will be responding to this box as well, even though it is climate change. There's never been a malfunction. There's never been a child. There's also a reporting mechanism with these boxes that the report goes to Safe Haven, so they have all the reports on this. Not a single baby has ever been injured.
Representative Cunningham.
Mr. Chair, I just want to make a comment, and I'll be real brief. I think everybody would love for a child to be placed in someone else's hands, and I'm a part of the Child Fatality Task Force as well. But if it has to be placed in a box to survive, I think we have to step outside of the box. and move along. So I'm not going to not support it because it is an alternative, because some people are too afraid to transfer their child in the other hands because of retaliation possibly. Thank you, Mr. Chair.
Thank you. At this time, we're into the debate. Yes, ma'am. We got about 1 minute. You ask away.
What happens when at the fire station everybody's out on a call? Does that leave anyone there to, especially small fire stations across North Carolina that have limited staff anyway? Is there going to always be somebody at the facility to address the box? And you don't really have to answer that question. It's just a thought.
You can answer it in 8 seconds. Go ahead.
I can. So this is voluntary if they do not have 24-hour staff. So if they leave, they can't have the box. Representative White.
Representative Biggs, you're recognized.
I move that the PCS for House Bill 139 be given a favorable report with unfavorable to the original bill with the re-referral to rules.
You heard the motion.
Just a bill, no PCS.
Pardon? No PCS.
Okay.
The motion is for a favorable report to House Bill 139 with a referral to rules. Correct, Representative Biggs? You heard the motion. All in favor, aye. Aye. All opposed, no.
No.
The ayes have it. Bill passes. We're adjourned.